I My name is Sean Eastman, and I was currently I'm the Director of Field Services for Clemson Livestock Poultry Health, which is in South Carolina, the State Veterinarian's Office. But before that, I've been here for about a little bit over 2 years, and before that, I was a practicing veterinarian for 21, and I practiced all over the place. My career has taken me probably to 3 of the 4 corners of the country. I've practiced in Virginia and South Carolina, North Carolina, and also in Montana, and also in New Mexico. So, been an equine vet. Of the 21 years I was in practice, I was an equine vet for 20 of those years, and seen 1,000 different ways to manage horses, which is really kind of cool. They're very adaptable animals, depending on what environment they live in. And so I did this presentation a few weeks ago for Brittany down in Aiken, and we're getting out of the spring pasture season, but with this rain and this cool weather, we're probably going to have some nice green, lush fescue pop up, and it might be appropriate here. Timing might be good for this. So when I do this talk, I've added some to it. So at the end of the laminitis spring pasture portion, I will switch gears and talk about core vaccines and deworming protocols, and then the obligatory regulatory stuff in terms of Coggins and health certificates. In the Southeast, especially our spring pastures, it's the devil's in the details and other things. In this talk, I'll start off with some grass composition. Now, I'm not as detail oriented when it comes to grass as Cassie or Chris Lemaster are. They're the gurus when it comes to really the weeds and the nuts and bolts of the grass. I'm a very basic knowledge guy when it comes to grass. And so I will glean over the grass and kind of give you the big basics, and then we'll move on to what that grass can cause. And you can see obesity and colic and laminitis. And then I'll switch gears. I'll ask for some questions after my laminitis is done, and then we'll move on to vaccines and the more pleasant things. So having lived out west, there's always a comparison between the Mustangs out west and the domestic horses that we keep up and we keep on pasture and we fence them in. The feral horse bands out west, you don't see them getting fat like our kept horses do, and that's because they tend to have to graze over extensive ranges, and a lot of times they cover hundreds of miles in a year just trying to get their grasses. Because grasses out there, they don't have the fescue and they don't have the orchard grass that grows naturally in their environment. So they have native grasses that are pretty sparse, and so they have to move a lot. And those grasses don't explode like our fescue does, or our Bermuda, or our orchard grass, or anything like that. So they have to keep moving. And as a result of that, a lot of times they come out of the wintertime in very lean condition. And so this is a photograph of some Spring Creek Basin Mustangs out west. And you can see, I'm going to use my pointer a lot, but you can see this horse is kind of tucked up in the flank. He's pretty thin, but you don't see any ribs. He's in good flesh, but he's just on the fit side, on the leaner side of a body condition score. Now the mare over here, you can see she's getting heavy bred, but she's still got a little tuck up in the flank there. So everybody in that little herd is coming out of winter pretty lean. As opposed to our domestic horses, because we keep them up, we don't work them as often in the wintertime as we would in the other seasons of the year. So they kind of stay up, and they might be stalled overnight or during the day, depending on the weather. And most of the time they're, in really good flesh going into the winter. So they're already overweight a little bit, and they come out having stood in stalls all winter and eating, and they come out of winter on the heavy side. And that's because typically, they've been feeding on good hay during the wintertime. Then we turn them out, and they got a smorgasbord of a buffet where they are dining on seeded and fertilized pastures, and they have no need to roam the 100 miles to find their food. So they tend to lay the fat down. This is a good example of an overweight horse coming out of wintertime. It's on nice green spring pastures. And he's got some fat deposits around here. He's got a fat deposit there and a fat deposit there. And his back here on his rump, he's got a big fat deposit. And he's just in, I mean, this guy would be a 7 or 8 on a body condition scale just because he's heavy. And that's what we face a lot in the Southeast. So in terms of the grasses, kind of back up and kind of look at those and learn what to look for in the grasses and in your pastures. Just like horses, plants go through growth phases, and I simplify it down to basically 3 phases. And if you can recognize these phases, you can manage those pastures and manage what kind of time your horses spend on those pastures, and it makes it easy. So the first one is the vegetative growth phase, and that's where you see this really short, really green, really fine bladed grass. That's where that grass is developing leaves. This is pretty much the vulnerable phase of that growth because they can get grazed down really easy. They can get stomped down really easy. And this usually occurs in the springtime. And it can also happen if you mow it or if it's overgrazed and you take the horses off of it and it starts coming back up, you'll see that phase of growth as well. And the grass uses these leaves to grab that solar energy, so that allows it to grow taller and get to the next phase of growth. So these horses here are on some really nice green lush grass, but the pasture down here on the lower right is really short and really lush, and that's what when I see a pasture like that, I say that's in the vegetative stage because it's really short, really lush and green. This pasture here is it's verging on the elongation phase of growth where they're getting more stem to them. But still, I mean, you can see this mare right here is fat. She's overweight because she's been dining on that. So the second phase is the elongation phase, and that's when the stem growth occurs, and pretty much the number of leaves pretty much stays the same on that grass, but it just has a lot of stem growth. And this is pretty much the best time to graze it because it's 8 to 10 inches tall, and you've got a good amount of fiber from the stem and a good amount of nutrition from the leaves, and it optimizes that nutritional quality of that plant, and from the grass's perspective, it ensures the survival of that grass. So here's an example of the elongation phase. See those big long leaves? You can see some stems in there if you look close, but it's a longer, taller grass and not as nutritionally dense as that really short, lush grass is. And the last stage of growth is the reproductive stage. And this is where you see the seed head, or in some grasses a flower develops, and all new growth of that grass ceases pretty much. And then the fiber content of that grass increases, and that drives the nutritional value down. It drives all those bad things down and kind of balances where you got more fiber than you do nutrients. And Cassie, if I'm wrong, please correct me. But I tend to get really basic with these things because I have to be basic for my own brain. So here's a picture of the reproductive phase, and you see that seed head. We see it in fescue. We'll see it in Bermuda grass. You'll see the little seed heads pop up, and that's just that grass's way of nature's way of trying to overseed itself and survive. So issues that lead to what I call the perfect storm, or the combination that causes problems, there's always a precursor to these problems. And most of the time you got these horses that are in a higher body weight or a higher body condition coming into spring out of the winter. They haven't exercised much during the winter. They've kind of sat, especially if they had a really wet, cold winter, they just kind of sit in the stalls a lot. And you combine that with the nice spring, dense growth of grass with a high nutrient availability, and it just spells problems. So the 3 most common problems we see is, number 1, obesity, and horses that come out of wintertime a little on the heavy side can quickly become morbidly obese, like the horse I showed you with all the fat deposits. It can cause some intestinal upset or colic. And then in the worst case scenario, it'll cause some laminitis. So the obesity part, every horse that grazes these spring pastures is at risk of getting obese just because it is so densely packed. That grass is so nutritionally packed that it'll just lay the fat down on them, especially if they are heavy to begin with, and especially if they haven't been exercised. And just like people, the obesity increases the strain on the feet and the joints and the heart. If you ever see horses that they get fatigued really fast, they're lazy, they get lethargic. If you really start working those horses too early, they'll get overheated really easy. And then you can't work them for very long, or as long as you probably would like, because they get exercise intolerance. And again, in the worst case scenario, they'll get metabolic abnormalities like Cushing's or insulin resistance or equine metabolic syndrome, any of those. That obesity kind of leads to all of that. So here's a body condition score chart that I got from Kentucky Equine Research, and I used it in veterinary practice a lot because it's a visual aid and it helps people. And you can go on their website. I'm not going to go through every one of these, but you can go on their website and print this out. And I had a copy that I printed out and laminated, so it was kind of weatherproof. And I would use it to educate on what the ideal body condition score is in horses. So colic or intestinal upset, these young growths of grass are really rich in simple sugars and protein and rapidly fermentable carbs. And as a result, they're inversely low in the slowly fermented fibers. And the problem with that is the horse likes those slowly fermented fibers. And this difference, when you get that out of balance, it can easily upset the populations of microorganisms in the intestinal tract, especially in that large bowel. So we've all seen it. I've seen it in my horses as well. When they're on good pasture in the springtime, the fecal balls will not be there, but they'll have more of a cow patty consistency to their manure. And that is a sign that, the diet they're eating is too rich, or that grass can progress to more severe signs, being bloat or gas colic, worsening diarrhea. A lot of times they'll get watery or projectile diarrhea, and then it can progress into more serious forms of colic. So how do we prevent these? And it's pretty simple sometimes, and then sometimes you just have to pay attention to your horses, and you just have to watch their manure. You have to keep an eye on them. If they get that cow patty consistency manure, you really should pull them off and dry lot them, or put them in a lot where there's not that lush grass, and feed them some hay. And this will give them more fibrous material. I actually, in the springtime, when I have one horse that I feed and I keep him up, but when I'm turning him out, if something changes, he comes back in and gets hay, and I'll feed him hay most of the springtime just to offset that rich grass that he's eating. You restrict that pasture time. Keep hay in front of those horses when they're up in the barn or in the corrals, and that helps to offset those nutrients from the grass. If it progresses to a certain point, we will see laminitis. So what is laminitis? For us to really know what it is, we have to know kind of what the anatomy is and just have a basic knowledge of the equine foot, and see how that works. And it's mainly there's a chemical deal going on in the body, but it creates a mechanical problem. So this is a cross section of the foot, and I'm sure we've all seen this, but you got your long pasture and short pasture and your coffin bone. This coffin bone is suspended by pretty much two ligaments. You have your extensor tendon right here, and you have your deep digital flexor tendon that goes up the back of the leg, and it comes all the way down and attaches to the bottom of the coffin bone. And that's what suspends that coffin bone within that joint area and in that hoof capsule. And it's called the coffin bone because it's completely within that hoof capsule, kind of in its own little coffin. And the blood supply for that bone comes from here, and that's the lamina. And I'll show you pictures of that in just a minute. And if that gets compromised, then we have issues. So this is this is a specimen of a horse that we necropsied and used for anatomy lessons. And what you see here where my arrow is the coffin bone. And then this is the lamina. And it attaches the hoof wall. It keeps that attachment between the hoof wall and the coffin bone. Now, it's dynamic. It moves because the hoof wall will grow down through that lamina. So there are finger-like projections here, and that hoof wall grows down through those finger-like projections. And that's what keeps your hoof wall growing, and at the same time, blood supply to the coffin bone. So here's another perspective of it, and you see all these folds, and they're just finger-like projections. And this is the one that, what you're seeing there is what borders, that's coming from the coffin bone, and out here along the hoof wall on the outside of that is the corresponding finger-like projections that fit into those grooves. And so everything is dynamic in that foot and depends primarily on that blood supply to keep that junction tight and keep that blood supply to the coffin bone. So we look at some x-rays, and I'll point some things out, but the biggest thing about this x-ray here, and it's an old one, so it's not very detailed, but I want you to gain an appreciation for the fact that we have the hoof wall here and we have the coffin bone there. Those two should be really close to parallel, these two lines. The front of that hoof wall and the front of that coffin bone should be really close to parallel. We like the palmar angle, which is the angle over the bottom of the coffin bone with the floor, to be 3 to 7 degrees. The Mustangs will have a steeper palmar angle just because they're barefooted and out on rough ground. In most of our domestic horses, we like it to be 2 to 4 degrees. And we also want this axis from the tip of the coffin bone up to the center of the fetlock to be pretty well a straight line. If we get that reverse C shape to that foot, then we have some angle issues that we have to correct. So here's a Mustang. Now, on this radiograph, you can see there's a dark area right on the outside of that coffin bone, and that's the lamina you see. And you can see it changes shade right here and becomes the hoof wall out here, and then there's that connecting, that line, and it goes dark. And that's the lamina that is attached to that coffin bone. So in some of these newer technology x-rays, you can really see the lamina. And again, all of that should be parallel. And in this Mustang, his palmar angle is 7 degrees. He's just a little upright, got a little more heel because he is over rough ground and needs that heel. So when we talk about laminitis, laminitis and founder are pretty much interchangeable, but there is a difference. Laminitis is just inflammation, itis being inflammation of the lamina, whereas the founder is the actual rotation of the coffin bone. And so most of the time, when I look at it from a veterinarian's perspective, I see laminitis that progresses to founder, and so there is a difference there. But these young grasses that are high in these soluble carbohydrates, they can overload the gut, and once they overload the gut, they disturb the natural balance of bacteria. And then once that balance is thrown off and you get too much of one or not enough of the other, you'll get a bacterial die-off. A lot of those bacteria will die. And when they do that, they break down and they release a bacterial toxin called the endotoxin. Now, this endotoxin circulates throughout the body, and it attaches to receptors all over the body. But the ones we're most concerned about are the ones that are in that hoof capsule and in that foot. And once that endotoxin attaches to the receptors in the foot, then the effect is it constricts the blood vessels. So it causes what they call a vasoconstriction, increases the blood pressure, and not as much blood can flow through those vessels. And it generally starts it in that short pastern, in that pastern area between the coronary band and the fetlock. And when you feel those two arteries on the back of the foot, you'll feel them just pounding, and you don't normally feel those. And that's because the blood pressure in that foot is increased, and it won't allow that blood to circulate to the foot. And because of that increased blood pressure and that increased constriction of those vessels, you will have a decrease in the blood supply of that foot. And then to account for that and to help with that, the horse actually has what they call collateral circulation. So up above the fetlock, around that fetlock and above, they have what they call collateral circulation. And it is these small vessels that go from one artery over to the vein. And what happens is when the blood pressure increases in the foot and you get that constriction, that blood finds a way to get back from the artery to the vein and go back to the heart. So there is no pooling of blood in that foot because it has that collateral circulation that can allow it to go back into the circulation in the higher up in the body. And because there's not enough blood going to that foot, the lamina, which is really a blood-rich structure, it's got a lot of blood supply, it needs a lot of blood supply, it gets compromised, and the connection between the lamina on the coffin bone and the lamina on the hoof wall, it gets weak. But that pesky deep digital flexor tendon continues to pull upward. It never takes a break. It's always pulling up, and when that occurs and you get a weakening of the lamina, it automatically pulls that coffin bone and makes it rotate. So here's my cross section again. So here's your deep digital coming up through there, and then here's your lamina over here. So when this gets weak and no blood supply, this continues to pull up, and the toe of that coffin bone comes down here. So here's a radiograph that when good grass goes bad, that's when laminitis occurs. And it's not necessarily just the grass, it's all the circumstances surrounding that. But you can see this foot here is nice and parallel, everything looks good. Horse could use a trim, but it's really not that big a deal. But in this situation, you can see that on the one on the right, the coffin bone is not parallel to the hoof wall. And so this horse is rotated, this horse is foundered. So one thing I did in practice that was really fun, and it's really, I mean, toys, that's the funnest thing in the world, and was venograms. And what we would do is we put a tourniquet up on mid-cannon on the horse, and then we'd inject dye into the artery and inject that dye, and it had no place to go but to the distal foot. So we could radiograph that foot and see where that dye went, and we could really analyze the blood supply and the circulation of that foot. And what you're seeing here is a normal foot. So you have all this circulation here, all these blood vessels here in the digital cushion, but you also have it up here by the coronary band and the coronary papilla. And then down here in front of that coffin bone, there's all this circulation here. Now remember, this is hoof wall, so it has no circulation pretty much. It has a little bit, but not nearly what this the lamina I have right here. And then you have it coming up under as well. And so when we have a case of founder and we want to analyze it, we want to make sure, we want to assess where that circulation has been compromised. And here's a case that's a repeat founder, as you can see by the dobbed off toe, and the horse is no longer parallel and is really significantly rotated. But in this case, this horse has repeat bouts of laminitis and founder, and you can see the missing circulation is right in there. And all of that just weakens that whole area and allows this lamina to get weak. And you can see, with this yellow areas in the way, but you can see the line right here of the lamina, and then all of a sudden it just disappears. And all this is scar tissue. It's just dead space. There's nothing there, nothing alive there. And that horse is struggling to keep that coffin bone within that hoof capsule. So this is a specimen I have that has been freeze dried, and it's a little bit color coded, but again, down here you see the deep digital flexor tendon, and it's not just at one small point that it attaches, it goes from about there to all the way back here. So it's got a lot of force pulling up on it. And then you can see in this horse, his coffin bone is right here, and if he doesn't have that bull nose to his hoof wall, everything is parallel. That's a pretty healthy foot, actually, and it looks really good. And here's the converse of that. You have a horse that's had rotation, front of that coffin bone is no longer parallel to this big long toe out here, and you've got all this separation here. All this white tissue here is scar tissue. It's from all the inflammation and all the aggravation and just the inflammatory cascade just creates all that scar tissue there. And you can see the white right here, and then it comes down and just disappears. And that's just lamina that's just been destroyed right in there. Here's those two feet are on a hinge. And I did that for educational purposes, but you can see the difference in these 2 feet when you put them side by side and you look at the bottom of them. Now, this horse did have a little white line disease, so there is a little bit of separation, but he's also in dire need of a hoof trim. But the key point here is all this separation from there to there is not normal. And that is not white line. That is a big, huge founder. So going to go through a few x-rays of some worst case scenarios, and I go from bad to worse on this. And so on this foot, you can see that white line coming down through here, that dark area here, and then it turns whiter at the hoof wall. And as you can see from about right there down, that whole thing is just non-existent. That line begins right there and ends up here. And this horse has got maybe, 4 or 5 millimeters from penetrating the sole. And I'm really surprised they had a regular shoe on this horse, because this horse is definitely a foundered horse. And this is a little worse. And this is a chronic case. You can see the lamina here, it come down a little shorter distance, and then it just kind of disappears. All this is scar tissue down in here, but if you notice, the coffin bone has a little elf tip to it, elf shoe tip. And that's just an indication that this has been going on a while and probably multiple times. Now they got his hoof wall looking good. Whoever the farrier was has done a really good job. But this horse is probably not going to be comfortable, and if he is, he's going to require more frequent shoeings. This is the worst case scenario, and this horse's coffin bone is disappearing before our very eyes. Back here, you can see all this fanning out of that bone, and that's just bone that is just going places that it can go because it has nowhere to go down here. And so you see that tip here, and then it just kind of fans out. Now, when you see these horses, that have these big elf feet, that's not what they all look like. This is kind of an exception to the rule in terms of this horse, just developed these, and that was this horse's response to that. A lot of these horses that have these elf toes out here still have a good coffin bone. But this horse probably was a sinker in terms of, instead of rotating, well, he rotated, but he probably also sunk. And instead of penetrating the sole, he tried to preserve that coffin bone and by remodeling it. So how do we see this in our pastures? And I tell people that my horses have to make a conscious decision to live or die on my place because I'm never there. But when I drive in the driveway or when I drive out of that driveway going to work, I look at them and I watch them walk, and I take 5 minutes and I just watch them move. And there are characteristic behaviors that tell me if they're sore or if something's not just exactly right with them. And the big one is camping out. You'll see these horses that are camped out in the front. They have their front legs way out in front of them. They have their hind legs that are tucked up under them. And a lot of people will sometimes think that it's a hind leg problem because they got that hind end tucked in and they don't want to walk on their hind end. It really is transferred. They have to put their weight on their back legs because they don't want to put any on their front legs. If you really pay attention to these horses, they're breathing hard. A lot of times they don't want to eat, and then you'll see them develop just recumbency. They just want to lay down all the time. They don't want to get up, and you'll see them laying down more than you'll see them standing up. So this is a horse that's got that classic stance. Now he's in a hospital situation, and you can tell by his bed sores he's been laying down a lot, but he's got his back feet out behind him pretty much, but he's sitting there with his front feet out in front of him. And this horse has probably, been treated, or he's on some anti-inflammatories to try to help with that, to take some pain away from his front end. But he's still, if it's hard to see in here, but on the initial picture when I first downloaded, you can see the grooves in his jaw where he's gritting his teeth. he's not a happy camper. And this you'll see, they've got this horse taped up and probably padded up on his feet, but he's in a really deep stall with lots of straw or hay and shavings. And he does not look happy because his third eyelid is prominent. You can just tell by looking at him, he's hurting. And you'll see a lot of this as well. So what about the treatment? Number one, it's going to be labor intensive. Number two, it's time intensive. And because it's labor and time intensive, it is also expensive. We have to put these horses in the hospital. We have to put them on IV drugs, on anti-inflammatories, on antibiotics, on DMSO. And then once we can get them over the episode, we use styrofoam pads or wooden clogs. And then 99 times out of 100, if there's been rotation, they're going to have corrective shoeing. So this is an example of the styrofoam pads, and I use these a lot in practice. I love these things because we put this pad on this horse, and in 24 hours, it would be compressed down, and there would be a perfect mold of the bottom of that horse's foot. And we'd wrap that whole thing, not in just those 2 or 3 pieces of duct tape, but we'd wrap it up in tape all the way up here above the coronary band. So you'd have duct tape all the way up here. I used to call them the astronaut boots because I would completely wrap that foot in duct tape with that pad. And I'd do that for 24 hours. And then I would take that pad off, cut all the duct tape off of it, take that pad that has the perfect mold of that horse's sole, put it back on his foot, and put a second thick pad just like this back on that foot, and then tape him back up. And I would do that for 3 days and sometimes 4. But what that would do is give that horse a really nice cushiony surface to stand on. And then hopefully within that 3 days, we've treated this horse with IV medications and can get him over the painful part of this. Then we can move on to something else and start working on trying to make him serviceably sound. Here's another one that has come along in the last 10 or 15 years is wooden clogs. And they, a veterinarian up in Northern Virginia developed these. And what it is, you see, from here on up, they've rounded the bottom of that toe off to give that horse kind of a rocking chair stride. So when he goes to walk forward, the key is to get him off of that, get kind of up on his toe and release some of the pressure from the deep distal flexor tendon. They work in certain situations. They don't work in every situation, but it kind of depends on what the veterinarian and the farrier decide to do, but they're very good tools. So how do we prevent it? Well, it's pretty basic principles, but it can be labor intensive. You want to limit your exposure to that lush green grass. And when I say that, what I say is, if I've got stalled horses that are turning out on spring pastures, I'll say turn them out for half an hour, 15 minutes to 30 minutes, and then bring them back in off of that pasture. And then slowly over, 2 or 3 week time, increase them to the time you want them out there. So if that's 12 hours or if that's 6 hours or if that's even 24 hours, just work them up 15, 30 minutes at a time until they're out there the prescribed amount of time that you want them out there. Just slowly increase their time on there. Also, when you do bring them back in, throw hay in front of them because that's going to help kind of cut down on all those, kind of balance out the sugars and the starches and the carbs. So to give you an idea, and I wish I'd had pictures of this when I was living out in Santa Fe and this horse came in, but I wish I'd taken pictures of this horse because he's probably the poster child for foundered horses. But we did work for a cutting horse ranch that had beef cattle out in Santa Fe, New Mexico, and the foreman was a really good client. This ranch, we serviced all the horses there, and he presented us with a 9 or 10-year-old quarter horse gelding that was used for cutting. He was a seasoned cutting horse. Ranch foreman calls from his truck on his way to the clinic, and he says, "I'm bringing a horse to you." And as the horse pulled into our driveway at the clinic I worked in, there was no horse standing in the trailer. He was down. And I looked at my boss, and my boss looked at me, and we went, "Uh-oh, this is going to be bad." And that horse would not get up in the trailer. So we had to back the trailer into the clinic and use the hoist that we used for surgery to get him into a stall because he was not getting up. Now on exam, all 4 feet had the coffin bone penetrating through the sole, and all 4 feet. And for that, the prognosis is grave. And 9 times out of 10, we would have euthanized that horse. But this ranch foreman said, this horse carries a 9-year-old girl around. He's going to carry a 9-year-old girl around again. So we had to do what we had to do to get this horse back. So we put this horse in ICU, gave him IV DMSO, put him on Banamine and antibiotics, and gave him fluid therapy for about, it was about a week or so. We gave him constant fluid therapy. We would take those feet, because he wasn't standing and we could just walk in there and do whatever we wanted to with him. We'd take iodine and sugar, mix it together and make a paste, treat those wounds on the bottom of his soles where his coffin bone was visible, take it, pack it with sugar dye, wrap him up in styrofoam pads or duct tape or anything that we could get on there to protect that foot and allow it to heal. And this horse was completely recumbent for about 3 weeks. We would have to go in there 2 or 3 times a day and just flip him over so he wouldn't get bed sores or decubital ulcers on his hips and his legs. And neither one of us really thought he was going to make it, but we were giving it our best shot. So 3 weeks into the treatment, he actually stood up one day. We walked into the barn and he was actually standing in his stall at 3 weeks of ICU treatment. He stayed in the hospital for an additional 12 weeks. And then at the end of that 3 weeks, when he came in standing up, we came into the barn and he was standing. We checked his feet. He had granulation tissue that had covered the coffin bones, which was good. In the end, after 12 weeks of working on this horse pretty intensively, the horse walked out of the clinic, got back on the truck, and rode to the ranch. And luckily, for the rest of his life, he carried that little girl around the ranch. Now, there were some conditions to that. He never got to see grass again, and he was never a performance horse. He was just a ride around the yard, ride around the ranch kind of horse. So cost, to give you an idea how costly it is to treat a horse like this. This horse had been a high-level cutting horse. He was approximately $80,000 worth of horse. To treat him in our clinic for that 3.5, 4 months was $65,000. So it can be expensive. It can be really expensive. The long-term care attached to that or added to that is corrective shoes at $300 to $350 for each set of shoes every 3 to 4 weeks. And that, again, that horse was on dry lot. He never saw grass again. So it can be really expensive. And the big take-home message for laminitis is an ounce of prevention is worth a pound of treatment. You know, if you take 5-10 minutes and just watch your horses and pay attention, they will tell you if something's wrong. And a lot of times we've learned that. I know I've learned that the hard way in life. So before we switch gears, is there any